Hello, my name is Dr. Kenneth Rosenstein. I'm a general otolaryngologist practicing here at BeckerENT. People have often heard of GERD or gastroesophageal reflux disease. There's a lot of commercials about it. It's a very common condition. GERD really speaks to the stomach and the esophagus, and the hallmark symptoms of that are going to be heartburn, indigestion, upset stomach. That is typically treated by a stomach doctor or a gastroenterologist. However, there are ear, nose, and throat related symptoms that occur as a result of GERD, and we call this LPR or laryngopharyngeal reflux. The symptoms there can be a foreign body sensation in the throat, a lot of throat clearing, kind of like especially after meals, a soreness in the throat, sour taste, bad breath, voice changes and hoarseness if the condition's significantly severe. And in children, we often see cough, especially at night, as a symptom of reflux. Gastroesophageal reflux disease, or the reflux conditions that affect the throat, are more often treatable than curable. That said, you do need a thorough evaluation to identify the root cause of the reflux. The vast majority of reflux patients need chronic management, either medication or most often just dietary modification by removing trigger foods or behaviors that promote the development of the symptoms. Gastroesophageal reflux is a very common condition. There's a lot of promoting factors that can cause the development of reflux disease. Obesity is one of them, poor diet, specifically certain dietary items that might not be reflective of a poor diet, such as excessive tomato use, excessive coffee, caffeine, all of these things. There can also be anatomical variations that promote the reflux of material, which simply means food particles and stomach contents going backwards, up the esophagus towards the throat. Hiatal hernia is one of them, where a portion of the stomach actually can come up into the chest. Esophageal dysmotility, which is a difficulty with the esophagus propelling the food downward and keeping it there. All of these changes can occur in different levels or in totality to cause the underlying reflux. So it helps us to diagnose the cause or the most likely contributing factors in order to determine the most effective treatment for the condition. The question about whether reflux disease is a permanent condition is difficult to answer. The reason why is there are a few underlying conditions that can be cured, although this does not capture the vast majority of patients with reflux disease. The vast majority of reflux is really caused by a combination of lifestyle, including dietary habits, exercise, and there are some genetic and hereditary factors in place as well. By treating those underlying conditions, one can often manage the reflux or really reduce the symptoms to zero. But like anything else with lifestyle, if you fall off the wagon, the symptoms do tend to come right back. So for the small percentage of people that are curable, it usually is a condition that requires a short duration of treatment, but that really is not the vast majority of people. Drinking water is essentially always recommended for health overall and is good for your body. It is definitely a treatment for reflux if it is in replacement of other liquids that would cause problems. For example, sodas, carbonated beverages, highly caffeinated beverages. There are some problems with drinking any volume of liquid when you have reflux, especially if you're about to lay down. When you fill the stomach with a volume of material, even water, and you lay down, that puts your body in a position where the pressure of the abdomen can very easily cause increased reflux. So for patients who have reflux, although water is better than any other liquid you would want to consume, we do recommend not filling your stomach at all 2 to 3 hours before bed. GERD pain is most often described as a burning pain at what we call the epigastrium, which is an area just at the bottom of the rib cage in the center of the chest. That's the most common description, although it can be described as chest pain, palpitations, a fullness in the throat, a soreness in the throat, or sour stomach. A lot of these colloquialisms are often used to describe a condition that's been around since people have been around. So The important part there is if this is a unique or acute symptom that you have never experienced, and it really is centered around the chest or upper part of the stomach, is to not automatically assume that this is a reflux related problem, and we never want to miss a cardiac event in a specific population and just treat GERD without a full evaluation. For your run-of-the-mill reflux disease, heartburn, indigestion, or what ear, nose, and throat doctors treat, which is the symptoms in the throat, which is a fullness, foreign body sensation, a cough, or hoarseness, we'll typically start with a treatment of anti-reflux medications. There's different varieties that are available and different molecules that are available, and we often choose them based on your other medications, what you have tried in the past, what has not worked. And typically, within 2 to 3 weeks, you will start to see a symptom reduction. In my experience, the stomach symptoms tend to resolve quicker. The burning, indigestion, sour stomach seems to resolve very quickly, where the throat symptoms do take a little bit longer. Thanks for listening to our responses to these very common questions. If you have any other questions or anything that comes up, we're happy to see you here in the office, so just come on in.